It seems that having a conversation about the role that the media plays in contributing to the bioethics dialogue is really important, and something that we wanted to have on the stage when we were discussing global bioethics. Jeff Kahn is the Robert and Rida Hecht Levy Professor of Bioethics and Public Policy here at Johns Hopkins. I've known Jeff a really long time, and we were so pleased when he joined our faculty a few years ago. Before coming to Johns Hopkins, he was the director of the Bioethics Center at University of Minnesota, and in addition to doing all the great and wonderful things that academics do, of note, he wrote a bi-weekly column for CNN.com for 5 years, so hundreds of articles, literally, on the role on bioethics. He would take a bioethics issue and put it in real-life language to make it accessible to the public. He really has a commitment to that dialogue between the public and everyone else in terms of bioethics. So I'll turn it over to you, Jeff. Thank you.
Thank you. Thank you, Nancy. And let me just add my welcome. It's been a really wonderful day and great to see many people who I have come to know and some new friends as well. I have to say, Nancy, in my 5 years of writing a column every other week, it gave me great respect for the work that journalists do. It's really hard to write on deadline and under a very short number of words. So you think academics have it hard? No way, by comparison to the folks who do journalism. So we're going to spend the next little while talking about media and health research and ethics. And as Nancy said, there's a really important role that the media play in helping us all better understand lots of issues in our lives. Of course, we pay a lot of attention to health research and ethics, and that's what we're going to hear from folks about today. Obviously very timely in light of the fact that we're living through lots of news and reporting about the Ebola outbreak in West Africa. So it's hard for many of us who don't have access to what's going on in that part of the world to understand what is happening. And that really important role that the media plays carries with it some great responsibility. And we'll hear, I think, about how working journalists find their way along the path that the challenges that arise in that work. So just to maybe lay a little bit of context, I thought I would take just a few seconds here and identify some of the kinds of issues that I think we're going to hear more about. So if I step on the presentations that some of the folks who follow will be listing, then I apologize in advance. So one, think about as we're learning about the work of our colleagues in healthcare and the ethical issues that they face, that journalists who try to report on that need access to the people and places and information to help the rest of the world understand what that's about. Very difficult, especially when we're talking about things like outbreaks in West Africa. Second, they have a really tough job of making what are quite complicated topics and issues understandable to non-experts. And when you hear them do that work, when you know about the topic, you realize sometimes what a bad job they do, but often how great a job they do at that. That is getting the story right, not a straightforward thing at all. Third, they have to report on issues and stories that are timely, that's what news is about, that are important, and that will appeal to the people who have to approve their stories, their editors, and to the audience that they hope to reach. So that's a really hard combination to meet without, say, number 4, raising awareness without skewing the perspective of the people who are listening. So you don't want to scare people out of their wits over an outbreak that may not actually be that problematic for people where they live. That's certainly been, I think, one of the challenges in reporting on Ebola for those of us who live in the United States. And last, certainly not least, that they need resources and time to do all of this well. So we're going to hear about, I assume, many, if not all, of these issues as we go forward. So let me now just introduce our first speaker. Each of our presenters will talk for about 15 minutes, and then we'll have time for Q&A as we wrap up the day. So the first of our speakers in this session, and I'm going to try to get this right, is Anu Nkematabong. I hope that that's pretty close to the proper pronunciation. Martin is a research officer in the Senate in Cameroon, as well as a working journalist for the Cameroon Tribune. I heard, and I need to say, I think for helpful context, that Martin is the first and only journalist who has gone through the Fogarty African Bioethics Training Program. A point of note, not just for the fact that he is a working journalist, but that he sees the importance of understanding ethics and doing his job in an ethically acceptable and appropriate way as a motivation for coming to do the Fogarty program. So, welcome, Martin.
Thank you very much. I will say two things, and then I go ahead. The first thing is that you will not have this on slides, because I barely completed this paper on the plane. When Joe wrote to me, I was far out of my country. And then the second thing is, I am a prince from a paramount dynasty in Cameroon. Prince in my dynasty declares, and they don't receive question with question marks. So, but I will answer your questions in the form of observations and discussions, but avoid question marks directly. Thank you very much. The next thing, I will use less than 15 minutes, but I will start with a case study, because I understand there are scientists here. You have designed a study to reduce the incidence of HIV amongst adults in a poor rural community in West Cameroon, where more than 50% of the population live on less than $1 a day. Your recruitment has been very successful. More than the required number of participants turn up to participate. And each participant receives $10 every Saturday for 6 months. A journalist visits the community and comes back with this brief, which he pastes on the column of his newspaper. HIV/AIDS, the pennies in trouble. A research study which aims to reduce the spread of HIV amongst adults in the west region of Cameroon was launched last month. Some 200 men who voluntarily accepted to participate have been circumcised to that effect. Various reports have attested that this method has worked in several African countries, including Zambia, Botswana, and South Africa. However, varied opinions hold that some of these volunteers, many of them married with children, have decided to sacrifice the tips of their penises just to grab $10 every week. This is the brief. How do you rate this journalist and his article as a scientist or researcher? It's a case study. We can discuss that after. Okay. I'll declare, as my culture permits, that in many African countries, particularly in sub-Saharan Africa, where access to new information and communication technology is still limited, the news media, that is, the newspaper, radio, and television, wield enormous power to focus public attention, as they remain the primary source of what people perceived about the world. The media exert a very strong influence on the priorities of readers and viewers and orientate their understanding of different issues, especially when the degree of uncertainty is high. In this regard, I have the honor to describe health research as one of those medical ventures with a very high degree of uncertainty and ambiguity, especially in poor resource settings like Africa, where human blood and other specimens are highly considered an integral part of the soul, which, if not protected, may be converted to food for witches and wizards. Where thousands limb and creep today due to unregulated candidate vaccines. Where stories about abuse and harm, which characterized the colonial past, are still painfully recounted from generation to generation. Where corruption has invaded almost every sphere of community life. Where many scientists, most of them top decision makers in the Ministry of Public Health, top politicians, and supporters of autocratic regimes have continued to violate international guidelines and principles by twisting research procedures and findings to suit the ideological framework of the government they serve. Where recurrent episodes of ethnic struggle and rising tendencies of genocide have murdered trust and extinguished the flare of nationhood. Where the health systems have been grossly invaded by local pharmaceutical agents who are ready to sacrifice all for selfish corporate interest. And where many ethics committees still constitute a college of fellow scientists not bold enough to denounce harm buried in study protocols submitted by unscrupulous fellow colleagues. These elements put together make health research in Africa a monument of doubt, fear, and distrust. Are we together? All right. Media setbacks. Trapped in this catalog of dilemma, the local health journalist finds it extremely difficult to perform his or her public service duty, which entails promoting clinical research by facilitating relationships between research investigators and the public through in-depth reporting, through in-depth investigation and accurate reporting of health research news. In a nutshell, health journalists in Africa are confronted by 6 major hurdles. 1, the adamant research investigator, who claims that media coverage of health research news, particularly clinical trials, is poor. That news about health research is usually misinterpreted or completely distorted by reporters who either lack basic knowledge about clinical science or simply fail to understand that medicine can be very methodical, slow, and subject to change, and that journalists persistently deform the true picture of their studies by paring down important quotes to simple sentences to suit the taste of their audience. Consequently, many research investigators have tightened access to research information and prefer to announce breakthroughs in peer-reviewed journals published in Europe and here in America. I will continue to quote a lot of facts from my practicum project, which I promise I will publish it next February. So, responding to my practicum, 62% of health journalists said they obtain health research information from press kits made available by pharmaceutical representatives. 25.6% said they receive research information from research participants. 4.7% from the Ministry of Public Health, 3.5% from science journals, 2.3% from the internet, and 1.2% from research investigators. 2, lack of basic knowledge and essential skills in health research reporting on the part of the journalist. Health research, I should say, is not a conventional subject in many journalism schools in Africa. Rather, more attention is given to infectious disease, immunization, and reproductive health. So in my practicum project, 26.7% of respondents did not know what a clinical trial was. 51.2% did not know the modalities of recruiting participants into a clinical study, and 67.1% said children do not participate in clinical trials. Meanwhile, 80.7% of health reporters had not had any formal training in health research reporting. 3, fear of veteran politicians alias research investigators. As I earlier mentioned, many research investigators are top politicians and decision makers in many governments in various countries in Africa. In an in-depth interview with 3 public media editors, all the 3 interviewees said they avoid health research because it is a sensitive venture, highly masterminded by the state, their employer, and that their master's voice editorial policy does not permit them to broadcast or publish any other information which contradict the position of the government. Meanwhile, 40% of journalists interviewed from the private media said a deeper interest in health research could either lead to forced imprisonment or absolute loss of advert and subvention from the state. 4, influence of advocacy groups. The lack of knowledge of health research and access to reliable research information has definitely lured many journalists into corporate battles where they act like mouthpieces for corporate agents with egoistic business agendas. In my practicum project, 59.8% of respondents said pharmaceutical agents were great collaborators, ready to provide money, brochures, and flyers at short notice. Remember, the Tenerife trial program, which was cancelled in March 2005 by the government of Cameroon, when a French NGO, Act Up Paris, co-opted the local media to alarm that the clinical trial was nothing but a bunch of harm designed to eliminate prostitutes in the country. 5, deplorable working condition of journalists. In my famous practicum, 71% of respondents, mainly from the private press, said poor pay packages, lack of basic working materials such as computers, telephone and internet services puncture the zeal to carry out investigations, especially in rural communities where access is actually very difficult. 6, unreliable ethics committees. The glutinous quest for their own share of the research package, the passion to readily approve study protocols submitted by fellow colleagues, and the lack of essential knowledge of review procedures does not make the ethics committee a reliable information source. Recommendation: train health journalists. I believe that a well-trained journalist will not only provide realistic and critical information about potential harms and benefits, but will certainly enhance the works of ethics committee through regular investigative trips to research sites. Improve relations between research investigators and health journalists. An atmosphere of trust will certainly shift journalists from their carnival backup position, increase accuracy and quality of health report, and consequently promote good clinical practice. 3, empower health journalists materially and financially. And lastly, separate politics from research. In this way, the health journalists will be free from persistent intimidation, justice will be safeguarded, harm will be reduced, and good will be done to a reasonable extent. Thank you.
Thank you, Martin. So our next two speakers are working American journalists. The next will be Nell Greenfieldboyce, who is known to many of us from our alarm clocks in the morning and our drives to and from work. She's a reporter for National Public Radio, so a very prominent outlet here in the United States. She's a science correspondent and has focused on not only health and medicine issues, but science more broadly. So she's going to share with us some thoughts about engaging the U.S. public in the ethics dimensions of Ebola in West Africa. And I'd be remiss if I didn't also add that Nell is a proud, I hope, alum of Johns Hopkins University from the science writing program. So welcome, Nell.
Well, good afternoon, everyone. Can you all hear me okay? Thank you so much to the organizers for inviting me. This is a great honor and a very interesting conference, and I was surprised to be asked to speak because I originally learned about this conference after contacting the folks at Johns Hopkins because I was actually trying to find more bioethicists from Africa that I could speak with. I was covering the Ebola outbreak, and we kept interviewing people like Jeff Kahn and Nancy and others, which is great, but I wanted to talk with some people who might actually be in Africa. And they mentioned this program and this conference, and I said, that sounds great. I'd like to come to this conference and hear what is being described because I would like to learn more about bioethics in Africa. And they're like, well, as long as you're here, why don't you speak? So I'm happy to do so and hope I can provide something interesting for you. For those of you who are not familiar with National Public Radio, we've been around since 1970. Our news programs are heard on about 800 radio stations across the United States. Our total weekly listeners, it's hard to measure the number of people who listen to the radio because people will come and listen for 15 minutes and then they'll go away and then they come back and listen later. But our total, the way they calculate it, is about 27 million Americans a week listen to NPR. We have two main news programs, one in the morning, one in the afternoon. We also have a newscast, a short news broadcast every hour. And many people listen in their car on their way to work as they're getting ready in the morning. We also have a website that does many print stories. All of our audio is online and can be listened to by anyone for free anywhere in the world. But we also do print versions of our stories that are put online just like a newspaper would put their stories online. We are lucky, unlike my colleague who just spoke, we report pretty much with no fear of reprisal from anyone. We view it as part of our job to hold the government and corporations accountable for their actions. Our staff is mostly highly educated. I do not have a PhD in science, but some of my colleagues do. We have a science desk that covers science and health. About 40 people work on the desk, doing nothing but science and health coverage. So that's not all reporters. Some of it is editors, photographers, but that's a lot of people for a national news organization to devote to science. I was asked specifically to speak about Ebola. We have a huge team of reporters that has worked on Ebola. We have people traveling in and out of the affected countries routinely. I did a search for Ebola on our database of programs and found that since March, we've done over 400 segments on Ebola. Anything from an interview with an expert, it could be an interview with a bioethicist, to a feature produced by someone on location in Monrovia or Sierra Leone or Guinea and Conakry. We also have news reports prepared by people like me. I have not been to West Africa to report on Ebola simply because I have a young daughter that I can't leave at the moment, but I would have definitely wanted to go if I could. The first story we did on this epidemic was in March. That's a time when many people in the United States were not paying attention to what was happening in Guinea. I think many people in the United States could not tell you where Guinea is. They have never heard of Conakry. They just don't know. It's not part of their daily life. We have a reporter in Africa, Ophebia Quest-Arcton, who is based in Dakar. She filed a short piece about the outbreak. And in the weeks ahead, we did more stories and more stories. But I think it's fair to say that in the United States, the public's attention did not focus on Ebola until American physicians got sick. There were questions raised about whether these American physicians would get experimental therapeutics. And then the American workers were brought back to the United States for treatment. That generated a huge amount of coverage, people with Ebola being brought to this country. And then it also generated a big response by the US government. Suddenly, Ebola was something the country was talking about, and the president and various organizations, federal departments, suddenly had to act. And then the coverage became much, much stronger, especially when we started having a couple people really, contract Ebola in the United States, in Dallas. So how does ethics come into this? Well, there are ethical subjects that we cover when we report on Ebola. For example, the ethics of using unproven therapies on desperately ill people who may not have access to the therapies that we know work. The first story I did on Ebola was in August. I covered this meeting the World Health Organization had to discuss whether it would be ethical to use unproven drugs and vaccines in the Ebola outbreak. For that story, I interviewed Jeffrey Kahn, who helpfully pointed out that it was very good to call for informed consent and freedom of choice and careful monitoring and transparency, but when you're talking about countries with a completely broken healthcare system, that's going to be very hard to make reality. In that story, I also spoke with Jerome Singh, a bioethicist in South Africa, because I simply felt I had to speak with a bioethicist in Africa. Otherwise, the whole story would be just people who were not in Africa talking about Africa. This happens way too often in American reporting on health issues. Other ethical issues we cover: the allocation of scarce resources. When you don't have hospital beds, when you don't have enough experimental vaccine or drug, who gets it? There are ethical considerations about quarantine in the affected countries, but also quarantine for our country. There was a strong political push from some people who wanted to ban all travel from the affected countries to the United States, which would obviously have a huge effect on things like getting resources to treat the outbreak. There are ethical issues concerning the obligations of wealthier nations to poorer nations, and the obligations of who shares in the profits if research is done in a poorer nation that is then exploited elsewhere. And then there's the issue of how Ebola interacts with other issues, other health issues like HIV, malaria, including other diseases sometimes we don't hear much about in health reporting from Africa and the United States, including cancer, high blood pressure, all the normal diseases that people get. Ebola had a huge effect on that. We spoke with healthcare workers who were no longer able to test children for malaria because the labs were closed. So all of those ethical issues are ones that we try to bring to our audience and explain to them. But then as reporters, we face our own ethical issues as we go about our own work. For example, we have to protect our colleagues, protect reporters. We sent a team to Monrovia, and the second day they were there, they were caught in a riot because the neighborhood of West Point had been quarantined, and people were upset about that and became violent, and the police started shooting. As one of my colleagues put it, a riot is tough enough without knowing that you're in an Ebola-affected country. My colleagues have talked about the fear they have They're trying to show our listeners what it's like in hospitals and treatment centers, but there's a lot of fear of Ebola, even if you're educated about how the disease is transmitted. One reporter said, "The strangest thing to me about this whole thing is that you're dealing with something invisible. It just preys on your mind all the time." So you have this dilemma as a reporter. You need to get close to the situation to show reporters what is happening, but you have to protect yourself. Then there's the balance between creating awareness of a problem and creating fear. If you look at the sheer amount of coverage to the 2 cases of Ebola in the United States, it's sometimes hard to explain to people why there was so much coverage to those 2 cases compared to the thousands of people who were infected in West Africa. We have to report the facts. We have to report what's actually happening. But there's always this issue of having to put it in a context, trying to explain other things that people may not be thinking about that perhaps they should consider. There's the dilemma of what interests people. Oftentimes, what interests them is what affects their daily life, but most people in the United States are not going to be affected by Ebola. We sent out a call for questions. We asked listeners, what questions do you have about Ebola, so we can answer them for you. One of the first questions that came in was, do pets like cats and dogs get Ebola? And it's actually an interesting question. There's been some research on Ebola in dogs, and the dogs that were owned by nurses, what to do with them actually became an issue. A veterinary organization issued some guidelines about what to do with the pets of someone who has Ebola. But at the time that that question was submitted, I did not want to spend time on our air answering that question when it seemed like there were so many other important questions and issues to discuss. We need to make sure that we're not just talking to experts from places like the World Health Organization and the Centers for Disease Control and Prevention here, but get voices from Guinea, Sierra Leone, Liberia, other places where the disease is. And what's been really helpful to us is being able to have teams of reporters and producers go to those countries. We've had a huge number of stories on our air from those countries. Many news organizations do not have the money or the resources to do that. And then finally, an ethical issue that we face is how to cover diseases that affect people in Africa without contributing to very unfortunate stereotypes and ideas that some people in the United States have about Africa and the people who live there. You know, we don't want to create this picture in Americans' minds of a poor, suffering African person. That's not the reality we see when our reporters go there. That's not the reality of people who are living their lives and making choices and acting in ways that are very similar to ways that Americans would act. So we try to make sure that people here understand the motivations and the situation and the choices faced by people who are facing this disease. And I'm thinking here of a profile of a survivor who lost many family members to Ebola and was working at a treatment center. And one of our reporters asked him, "Why do you want to stay working at this treatment center where so many of your family members have died?" And he said, "Well, you know, when I was sick, there were people sacrificing their lives to fight for mine. And so I have to do the same. I have that humanitarian feeling for those working here now." I think it's important that humanitarianism isn't something just that people in the United States feel towards people in Africa, but they understand that people in Africa feel that way and are doing that too. And so I guess I would just close with a plea. You know, I'm very grateful to be invited here. I'm interested in your work. If you learn of any situations in Africa with regard to Ebola or really anything else that you think is being done in a very good way or a very bad way, I would like to talk to you. And my contact information is very easy to get. Thank you very much.
Thank you, Nell. So last but certainly not least, we will now hear from Dr. David Brown, and I introduce him that way because unlike many journalists following reporting on health and medical issues, David is both a physician and a journalist. He continues to practice medicine, I think, a day a week in your doctor life, and otherwise a journalist. And for 22 years, David was a health and medicine reporter for the Washington Post. So David will share his thoughts with us about experiences in ethics and global health reporting. Thanks, David.
Thanks very much for inviting me to this symposium. It's a privilege to be with this distinguished group of speakers and guests. I want to make a few observations from my 22 years as a science and medicine reporter at the Washington Post. During my time there, I covered many clinical trials, various global health issues, and a handful of natural and humanitarian disasters. Bioethics was not the focus of most of my reporting by any means, but bioethical concerns are never too far away from any topic in medicine. They are present in many clinical trials. They are even closer to the surface in research conducted in places where the resources and culture differ greatly between the investigators and the investigated. The first point I want to make is obvious to a journalist, but perhaps not to patients, research subjects, and medical scientists. It is simply that news coverage of what medical treatment looks like and feels like, and how medical knowledge is gained through research, is an absolute social good. Reporting on medicine from the clinic and the field, and not just from the pages of journals, is essential for demystifying science. It helps people understand where the health care they value so highly comes from. It's essential for getting the buy-in necessary for the never-ending public investment in medical research. Perhaps most important, it's essential for the protection of patients. Medical researchers and practitioners have traditionally been wary of the press. Hostile is actually a better word. No less than this institution's secular saint, or it's perhaps the institution across the street, Dr. William Osler once wrote, quote, "Believe nothing that you see in the newspapers. They have done more to create dissatisfaction than all other agencies. If you see anything in them that you know is true, begin to doubt it at once." But Osler was from another era, an era when the only moral agents in medicine were the doctors. Nobody else had any say, or often any rights. And patient privacy and confidentiality were values that couldn't be challenged. Unfortunately, the good that came from confidentiality was sometimes outweighed by the harm that confidentiality kept from coming to public view. This happened not only in clinical research, but also in clinical care. Just to give the most glaring example, the abuses of hospital psychiatry in the first two-thirds of the 20th century in this country are an example of what happens when medical authority is supreme, medical knowledge is sparse, the patient's voice is devalued, outcomes aren't measured, and everything is kept secret. Privacy should not be a supreme value in medicine. It should compete with other values, one of them being public scrutiny. That doesn't mean that reporters should be able to wrest the medical chart from a doctor's or a patient's hands and put it in the contents of a newspaper. But it means that physicians and researchers should expect, and if they're smart, welcome and assist the scrutiny of the press. So should patients. In the end, the best interests of patients may be as well protected by the scrutiny of the Washington Post and NPR as they are by IRBs and HIPAA. The second observation I would like to make is that self-interest on the part of a sponsor of research, or even of an individual researcher, doesn't necessarily make their activity unethical. This is unfortunately an assumption of much of the public and the press. And it frequently comes up when American or European investigators do research in low-income parts of Africa and Asia. It is easy to caricature the various players in medical research, and in particular to paint investigators as people who will overlook the interests of patients in order to get the information they want. It's important, however, to assume that researchers are behaving ethically and playing fair until proven otherwise. Sometimes they are proven otherwise, but it's important to dig deeply and go beyond first impressions before reaching that conclusion. An example of this occurred a number of years ago when a major newspaper reported on a study that the drug company Pfizer did in northern Nigeria during an outbreak of meningitis. The study randomized children with meningitis to get either an intravenous antibiotic, ceftriaxone, or a new oral antibiotic, trovafloxacin. The newspaper story was the first in a series of articles about the trend of American and European companies to test some of their drugs in developing countries, certainly a newsworthy subject. This article left the impression that children in Africa were used to test this drug because they were easily exploited, and it was too much effort to run the study in the United States. Furthermore, the article suggested the subjects of the study were denied access to a drug of proven benefit, ceftriaxone. Now, it is true that Pfizer wanted to know how this drug did in children. Members of the same family of drugs, called the fluoroquinolones, sometimes caused arthritis in juvenile rabbits. For that reason, fluoroquinolones had never been used in pediatric studies. But nobody knew if the arthritis phenomenon occurred in juvenile human beings. This was an opportunity to find out. And it turns out the problem didn't occur in children. The story seemed unfair to me. I suspected the issues and motivations were a little more complicated than presented. After I read it, I called up Dr. David Heyman, who was head of communicable diseases at the World Health Organization at the time. I asked him what percentage of children in Africa's meningitis belt lived so far from a hospital that they wouldn't be able to get intravenous antibiotics soon enough to save their lives or prevent permanent brain damage. He said at least 1/4. As nearly 16,000 people died in the meningitis outbreak in question, that estimate suggests that up to 4,000 lives might have been saved with an effective oral antibiotic, oral meningitis drug. While the article had made passing reference to trovafloxacin's potential usefulness in Africa, there was no attempt to look hard at what the possible benefits were for all parties in the study, which is certainly the first step, though not the last, in determining whether a study is ethical. Interestingly, the story also didn't mention that there was actually one more death in the ceftriaxone arm than in the oral antibiotic arm, which would suggest there hadn't been prima facie harm. Now, there were serious problems with this clinical trial. rude behavior on the part of the investigators, no lasting improvements to the hospital or staff training, backdating of documents by one of the investigators, etc. But it wasn't the evil cartoon it was depicted to be. But if it's important to look carefully before concluding that exploitation is occurring in research done by rich companies and universities working in low-income countries with poor patients, it is also true that research involving vulnerable populations is trickier and more ethically challenging than in other places. Which brings me to the third point I want to make. Clinical research anywhere, but especially in resource-poor areas, must constantly be on the lookout for evidence that the conditions on the ground are evolving. A study that is ethical 1 year may be unethical 2 years later. The reason is not only that medical knowledge changes, but also because practical things like the cost and availability of drugs also change. Even changes in something as hard to define as society's consciousness can be enough to make a once acceptable study unethical. This was seen repeatedly in studies involving HIV testing and treatment in the developing world over the last quarter century. This evolution of research, design, and ethics was the subject of much news reporting, including my own. It was a topic at least as important as the results of the studies themselves. For example, at one time it was acceptable to run studies that attempted to prevent mother-to-child transmission of the virus by giving pregnant women antiretrovirals in late pregnancy and in the postpartum period, and then stopping the drug. When studies showed, to no surprise, that HIV-infected people in developing countries could follow ARV regimes as well or better than people in the United States, then it became unethical to not continue infected women on ARVs indefinitely. As drug prices fell and antiretroviral therapy became more common, it became unethical to not treat all the infected people in a household, not just the infected mother. And on the responsibility to research subjects has evolved. Ethical principles may be valid across time and place, but applying them in any particular time and place is not as straightforward as it seems. It requires a constant dialogue with the population one is studying and with oneself, and it requires the ability to say no, even when you wish you could say yes. Thank you.
Thank you all three for very articulate and insightful remarks. So Nell and Martin, will you come up to the table here and we can take some questions, comments from the audience. Is your phone, David? I can, so Joe, you have the microphone, or people can come up, I guess, to the stands. Anybody have a question? I can start maybe while you're getting warmed up. So you all have in various ways and through various examples, I think, made a compelling case that the picture is often complicated for reporting on these sorts of stories. But you all come from old media, as it's known. So I wonder, old media, print, television, radio, I wonder whether you think new media and all of the features that new media offers, from internet to social media, help or hurt in demystifying or uncomplicating the picture of some of these stories. How can it help, or how maybe it's a problem that's making things worse? I'm interested in your thoughts.
Well, I'll take that one. So those are fighting words, Jeff.
I'm trying. It's end of the day. I'm trying to be provocative.
So NPR has been around since the early 1970s, but you can listen to National Public Radio on your iPhone or on your even in your car, on Wi-Fi on your car. So I refuse to think of us as being old. We have a Twitter account. We have all sorts of new media things. But I will say that, for me personally, I'm all in favor of the so-called new media. I'm in favor of making it easier for people to talk to each other. And I think that it's a tremendous thing now that so many people in Africa have access to cell phones and the internet. And as a reporter, I can use that to try to find sources, people to talk to that I would never have known about before. So yes, I'm part of old media, but I use those tools in my reporting, and I'll use anything to find people.
Yeah, so among the things I was thinking was pretty much everybody's a journalist now, right? Not just do traditional professional journalists use new ways of communicating, but rather if I have a cell phone with a video feature, which everybody more or less does, I can effectively be a reporter on the ground in fill in the blank. Or I can blog and write anything I want. Or I can tweet about anything I want, some of which may be very insightful and interesting and maybe factual, but maybe not so much. And it's hard for people sometimes to filter fact from fiction. Truth is a complicated term. And I wonder whether you confront that. It's maybe not a judgment question, but more of a factual question. Is it making your lives more complicated or less, or do you see value or not?
I'm about as old media as you could get, so this is sort of at one remove. But I guess one of the things I tried to suggest in my remarks was that there are real subtleties to ethical issues and to trials in which misrepresentation is very easy, and if one goes in with certain assumptions, you can generally cherry pick facts in order to make something appear the way you want. And I think that the fact that the length of Twitter messages do not allow you to provide any evidence, they just really allow you to make a statement or an opinion, and the fact that blogging in its looked at most cynically, blogs are simply poorly reported news stories. They're kind of news stories with one voice or one or two voices in them. That new media has a lot of advantages, but it's also a way that very distorted versions and views of very complicated issues can get spread widely very quickly.
Okay, we've got some hands. So Joe's got a microphone, Len's back there, and then in the front as well.
Thank you. Those were great presentations. You're all serious science journalists. But you confront, and Nell alluded to this, that if you take Ebola, there was a serious attention to what was going on in West Africa. But there were also a lot of circus aspects to this, where politicians, members of Congress were proposing kind of ridiculous solutions and getting media attention. And the question is, how do you judge? How do you cover that? How do you judge when, forgive the expression, some Yahoo politician is trying to influence policy and public opinion where you really need to get the real story out Or is that the real story? Does it become a political story, which it did in some respects? Could you address that kind of tension?
Well, I guess I would say it's not an either or. You do both things, okay? So, I mean, at the same time, we had reporters on the ground in, Monrovia reporting on what was happening with the treatment centers there. We had reporters in Washington, D.C. covering how Ebola was becoming an election issue here in the United States. How, political candidates were suddenly talking about Ebola, while that was not a particularly important election concern here previously. I think one story I did for our website was about, I don't know if you remember, but one of the healthcare workers, a lab technician who had come in contact with a sample of blood from the Liberian man who eventually died in Dallas. One of those healthcare workers was on a cruise ship. Do you remember that? And so there was this issue about, like, would they be allowed to dock the cruise ship in Mexico? And at one point, they sent a helicopter out to retrieve a blood sample from this person, a Coast Guard helicopter. This person who had no symptoms and was confining herself to her, cabin, I guess you would call it, on a cruise ship. And so we covered that and said, well, what was that? Like, why would you do something like that? Like, does that seem like a public health tactic that is necessary to protect the public, or is that just going to make people scared? I think that all of those jobs are important to do, and we try to do all of them. And, I do think there's only so much we can cover, and I personally think that blogs and Twitter and other things like that, there's a lot of nonsense out there. I mean, anyone can say whatever they want, and there's problems with that. But I'm never going to be opposed to more free speech, personally. And I feel that oftentimes, if the media is ignoring something important, now there's a vehicle for ordinary people to get their voice heard in a way that didn't exist before. So.
Yeah, and I think that reporters report what's happening. They don't make up what's happening. And if the governor of Maine or the governor of New Jersey, states publicly that they think someone should be kept in a tent or kept in their house for 21 days and can't ride a bike, we have to report that, and it's completely inappropriate for us to say, by the way, Paul LePage is a Yahoo or Chris Christie is a Yahoo. But what we do is we go and explain through the voice of experts and through the voice of evidence why that may be an overreaction that has consequences that are not obvious, such as chilling the willingness of people to go overseas, et cetera, et cetera. I can't tell how many times I heard on NPR's air, that Ebola can only be caught through, contact with body fluids, et cetera, et cetera. So, these things that don't make sense that happen in the news, one addresses by telling what the facts are, but you got to cover the news.
I have a question for the three of you. In research, we have the issue of privacy and confidentiality. So, when you report, how do you protect us if we give you that information to report, or you observe something which is not done right, so that it doesn't blow out of proportion? Because I have to answer to my participant who has given me the information, because I promised them of privacy and confidentiality. That's one. Then two, we lack guidelines. Most of the guidelines do not tell us how we should handle these ethical issues, which should not be put out there in the public. So we have that problem of lack of guidance on how to handle information from research that should not go out in public. I don't know whether you get what I mean. We get caught up between having somebody's information kept in confidence and also protecting their privacy, which when you report, now it is going out in public. So how do we trust you that you will protect us from the information that we give?
Hello. We have various journalism codes which permit us to protect our sources at all costs as much as possible. We are not obliged to pronounce or print your name in the newspaper to say this is the source, okay? We are not obliged to do that. And then one of the things that brings a lot of tension between researchers and the media and the journalists is this issue of you trying to seal the doors of your laboratories. Most often, I have advocated that if an atmosphere of trust existed between you, the researcher, and the journalist will know exactly how to go about his or her job. He will know exactly how to present your stories. But I want to observe that most often we use an orthodox method to get information. We use all sort of tricky method to get information. So it's at one moment, once the information is not complete, once it is not satisfactory, the journalist is sometimes bound to write, from the vacuum to make it readable and understandable. So I have advocated all the time, let there be collaboration, let there be trust, so that we can always come back to you. Give me this information. I will not name you, but I will give the information as it is, so the public can understand.
I actually want to address that too. I'm a big believer in informed consent, especially in journalism. And when I'm no longer reporting for a newspaper, but when I was, I would tell every person who I wanted to either observe treatment or observe some interaction with an investigator, some activity, told them exactly what my role was, the fact that I wanted to use their name, get a picture of them. Sometimes you negotiate and say, okay, I can use your name, but you don't want a picture taken. Sometimes they will let you observe them, but not use their name. That's very much an undesired compromise for journalists, but sometimes it's necessary. But I always made sure that they were clear that anything you say to me, you've got to be willing to, have appear on the front page of the Washington Post. And if you're not willing for that to happen, then don't talk to me. It's perfectly fine. No problem.
There's also, sometimes people want to give journalists information but don't actually want to give it to them. And sometimes the most useful thing is just telling me, hey, you should take a look at this. Or, hey, did you know this meeting was happening? Or hey, you know, maybe you should look at what such and such is doing. Oftentimes people, they tell me how I can get the information. You know what I mean? So like they're basically pointing me in a direction rather than taking me by the hand and leading me there. Does that make sense? Because in that situation, there often will be so many people who know about that information that no one could ever know who told me to look there. You know, there could be dozens and dozens of people who know about it. But if no one tells me, I will never look. How would I know? You know? So there are times when we can do stories that never mention ever the person who told us to take a look there.
Joe, back in the back. Okay, great.
Okay, so this was a very interesting session again. I just want to speak from experience in India. I think what's been interesting there is because of the fact that in many low and middle income countries, often bioethics also has this sort of cross-fertilization with activism, that there is a certain usage of the media which the folks in the ethics community have done. So for example, in India, the media has very much driven the whole issue of clinical trials and the kind of unethical clinical trials which are happening, which have then led to even the Supreme Court of India getting involved. And now we've had stringent changes, regulatory changes, some of which many of us are uncomfortable with as well because they've sort of swung the pendulum to the other side. But this interesting sort of interface between media and bioethics in many of our countries, in a sense, also ensures that there's more transparency, accountability, and one way of ensuring that policy change occurs. Because when you have the media getting involved, policymakers also get influenced and pressurized if you have daily coverage happening. Like, you talked about some of that in the panel around Ebola and the fact that once it became such a big media hype, the politicians started speaking, and maybe there are sometimes unfortunate consequences to this. So that's number one. The other issue is I think ethicists or bioethicists, when you when you become available and out there, I think a lot of times journalists also reach out to you. I've had this experience just in the last 7 days. I've had at least 3 journalists contacting me via Twitter saying, I'm doing a story reviewing Atul Gawande's new book on being mortal. What do you think about end-of-life care in India? Or saying, is there anything new about corruption? We are doing a series of articles on corruption in medicine in India. Is there anyone new I can speak to? So I think one, you can serve as folks who are providing information to media, but you can also source as a conduit in terms of passing on information and saying these are the right people to talk to, or you really need to highlight patient perspectives, or you really need to talk to the research participants because their voices are not being heard. It's just the same bunch of people. So I think that's where, again, bioethicists, especially in our countries, can play an important role by interfacing with media, is to ensure that those voices are heard, which are conventionally not talked about. And the third issue was new media. I think that's where, being there on Facebook, Twitter, any of the new social media formats is really useful, because not just is your voice heard within your own countries, but as we are all discussing in the region as well. So I think when we have a community to be able to share our insights, new findings, it really helps, because often we face paywalls, we're not able to access journal articles, but if we can distill some of the learning of what we learn individually and share, that really helps. And now even journals are using formats like blogs. So BMJ has a big push to use BMJ blogs in India, and they encourage doctors, ethicists, patient representatives to come and write blogs, because people might not have the right to go in, might not have the time to write a full article, which needs to go through a peer review process, but a blog is maybe a day's work, but still makes some important points at the right time when there is a controversy.
Maybe we take 2 more, 1, 2, and then I think we need to turn it over for closing remarks.
Bavon Mupenda from the DRC. Mine is to show how happy I am to discover people and new area of interest for us in research ethics. I was wondering, what are these journalists coming to do in our area? And number two, they spoke at the last moment, which means people are tired. But to tell you the truth, I was surprised. Oh, how good they are talking. Not only as journalists, but, and I will pick Nell. She really struck me with the depth of areas of dilemmas, including this coverage of two people, very well given, and thousands are not even known. Then I had this comment to Nell. So who do you think is going to hear you here when you raise those nice dilemmas? And two, what later, if they don't hear you, are you going to use to force them to hear you? Because you have used a very good thing. Thank you.
Who do I think is going to hear me? I think millions and millions of people hear me. I don't think that, I know that. And that's why I take my responsibility very seriously. I feel that I have a sacred responsibility both to my listener and to the people whose stories I'm trying to tell. So that's who I think is hearing me. And if I feel like they're not hearing me, I just keep saying it. I can't tell you how many stories I've done on is Ebola airborne or not. I mean, I'm trying to think of how many. So yeah, we'll just do a story again and again. If people don't seem to get it, we'll just keep doing it.
Last question.
Well, thank you for giving me the last chance. They were joking, which is true actually. I live in a village, and I get these researchers coming, and they gather the data, they go, they analyze it, and later on they publish it maybe in the Lancet or in Science and so on, and you pick it up. My concern is the research participants are the owners, in a way, of that, they are the source of the information. And yet you journalists, what you put out, you are putting it out, making the owners of that information the last to know about it. Or even the researchers who are working right at the very end in my village, it will take them a long time to even know, if they will ever know, that this is what happened with their blood or with their urine or whatever it is. What's going on? Is there some way of maybe networking with research, with the journalists at the periphery, so that they can get that information to the source, instead of these people always waiting and maybe many months before they even know the results that of their blood. I don't know if I'm understood. Thank you.
Last thoughts from the panel? Okay. Oh.
Well, I don't know. I mean, can it be made a requirement of doing research that the investigators inform the research subjects of the results of their finding? I don't know the answer to that. I'm not sure why it's my job to inform them. I mean, I can only tell people about something when I hear it. And if I don't hear about it before the research comes out in a journal, I can't tell anyone because I don't know. But I mean, the research organization knew. They were the first ones to know. So I guess if there's a desire among bioethicists to have research subjects be more informed about how their contribution, the results of that effort, is that a requirement that can be made? That's a question for you guys, not for me.
Yeah, I think there's two issues there. One is, what is the work product of the research that this person has contributed towards? And as Nell mentioned, I think that's really the job of the investigators to inform the subjects. And in fact, there's all sorts of issues involving, how much investigators are willing to tell reporters before something has been published, because of this rule that was created by the New England Journal that something that has been previously published, which can be interpreted as the results heavily reported in the press, won't get published in the journal because it's not new. The second issue is, how can the subject get exposure to the journalistic work product? And if you're a newspaper reporter, then you can, in the old days, tear out the page of the newspaper and send it to them. It's a bit of a chore, but it's something that really pays off. Now you can send them a link, but when it comes to someone who is living in a village in Africa who doesn't have a computer but may have a cell phone, how that link is made, I don't know. It's probably more challenging, but again, it's not something that I've had to try to address myself.
So you have been great. Thank you all for participating. So Nell, David, and Martin, thank you very much. Great job. And now I have the pleasure of handing it back to Nancy and Adnan for end of the day remarks.
All right, I'll echo my thanks to this panel. Totally spectacular, exceeding our expectations, and to Jeff for moderating. So I'm going to start the closing and then turn it over to Adnan for sort of the final closing remarks of the day. I'll start by thanking all of you for staying. I will confess that Adnan and I in the morning looked around and we were so pleased to see this full room, and we thought, are they still going to be here after lunch? And it turns out you are, and it's a remarkable crowd. So we've said many times how remarkable our Fogarty alumni are. In addition to the Fogarty alumni being here, just in case you haven't gotten to know everyone in the room, we do have additional people here. We have people from 20 countries. We have people from the NIH, the CDC, and OHRP. We have people from Johns Hopkins and from outside of Johns Hopkins, and obviously we have our colleagues in journalism. And that's what bioethics is all about. So I want to just make two substantive comments before a couple of thank yous that both seem to me to be maybe big take-home messages from today. And both of which probably are fairly obvious, but I'd like to say them out loud anyway. The first is that in bioethics, while on the one hand we teach principles, and many people in this room have taught bioethics in an introductory way to people who've never had a bioethics course before, and there are certain kinds of ideas and principles, and every once in a while some absolutes, but not very often, that we try to communicate. What's really important is context, and what has been so clear from this. From all of the presentations today, is that context really matters. The same study conducted in Baltimore and in Uganda might sometimes be considered ethically appropriate and sometimes too risky. And the same study with informed consent conducted in a certain way might seem appropriate and might seem inappropriate. And while in a certain way that's obvious, if we start to teach bioethics without always saying there needs to be an interaction between the study design written on paper and an understanding of what respect means in that context, what harms could accrue in that context, what fairness means in that context, we're not going to be doing our job as bioethicists. The second piece, which to me builds on that directly, is the importance of collaboration and talking to each other. I have said throughout my career at Johns Hopkins that one of the luxuries for which I am so grateful in working here is that I have the ability to collaborate with my science, medicine, public health, technical expert colleagues on pretty much every project I do. I don't have the confidence to know the real nitty-gritty details about very particular subjects, and that's essential to get the ethics right. Not only are those kinds of collaborations right, but as we've clearly illustrated, I think, through discussions today, if we're talking about something that happens in various parts of the globe, It's not only to have that voice, it's to have collaborative voices, it's to have discussions, it's to try to understand why somebody wants to do something one way and what the local context is, and really getting that on the table. So I guess context and collaboration are the two themes I just want to say out loud as part of my own personal take-home messages. So let me do a series of thank yous at risk of maybe Adnan and me doing some duplication. I want to start by highlighting, if we haven't done it enough, Professor Wen Kalama. Professor Kalama, before we had Fogarty programs, was talking about ethics out of his work as one of the leading malaria researchers in Africa. And he recognized and said out loud, and first sort of did through his own nonprofit and then through getting money from the Gates Foundation, that you can't make health progress in Africa without research, and you can't do high quality research without ethics. And he got that message across and trained a lot of people in this room for their first workshop, and then we were able to get the benefit of that for some longer term training, and then they turned around and taught in his workshops. And my hat's off to you for really being I think the I don't want to say the grandfather of this, the visionary for this within Africa. So thank you for all that you have done and for being willing to join us for this week. I want to do my personal thanks to Joe Ali, who made all this happen, Christina Hlth, who made all this happen, and to my partner in crime, Adnan Hyder, who makes all of this work better and more fun for me. Our alumni, who are really spectacular, who gave up a week from their incredibly busy lives. I think my life is busy, but as I've said several times this week, these are people who are so precious in their environments for having education and talent and get called on to wear so many hats in their local environment. And to figure out how they were able to come here is really a gift to us and to each other and the community that we've been trying to build through this program. And last but not least, thank you to Fogarty, not only for funding this, but for being here, for contributing, for being partners along the way and making it all possible. So thank you.
Thank you very much, Nancy. I am now holding these people between reception and the end of the seminar, but I won't hold you long because my job was just made 10 times easier. I want to first of all say that this day has been remarkable because if you recall, we started the day with this outline of the challenges in bioethics over the years and the 4 questions that Professor Ruth Faden asked us to remember about justice. And I won't go through that again, but simply to highlight, let's make sure we don't forget those questions in our work as we go forward. We also heard about the intersection of politics and public health, and this intersection that is so complex, so difficult to handle, where context actually really, really matters. We've also heard about the capacity development initiatives, the changing landscape over research investments, capacity development investments, the different agencies that are working on the continent, and how they are contributing to the development of research ethics capacity in Africa. And then, of course, this wonderful session in which we talked about media and bioethics. And I think what this seminar has really raised are so many more questions that I think many of us in the room, and also those who are listening to us on the internet, have now an opportunity to do several things. One, we can discuss with each other a lot more, brainstorm, come up with interesting ideas, maybe write papers on it, who knows? But also decide to work on some of these issues as well. Both scholarly work, it can be a publication, research in the form of empirical work, or other initiatives and projects that can bear fruit. I think and I hope that this day has been stimulating for all of us in actually beginning something new, in developing a new collaboration and developing new networks. I'd like to thank everyone on behalf of course, the Bloomberg School of Public Health, the Berman Institute of Bioethics, the Johns Hopkins Fogarty Africa Bioethics Training Program. My thanks again particularly to my colleagues Joe and Christina, of course, who've done a remarkable job, and also Kara and others in our communications team, the School of Public Health communication team, and the event management team that have done a remarkable job and have been sitting there and live streaming us since 9 o'clock this morning. Let me end by saying that I think this is not the end of our discussion. I really would like to push you to make this the beginning. We have not only the traditional media, but we do have social media, and it's been pretty active during this meeting. For those of you who've been watching the Twitter feeds, particularly by colleagues like Anand and Freddie and others, we've been talking, we've been chatting. I hope that this dialogue will continue. It's really exciting for us. It was a humbling experience to see the wealth and diversity. And I close by thanking, of course, our Fogarty alumni who bring this richness to our dialogue. Thank you very much for attending, each and every single one of you, and please join us downstairs for some reception. Thank you.